Kia ora koutou katoa. Thank you very much for inviting me here today, and tēnā koe to the mana whenua here. I'm sorry I wasn't down yesterday, so I missed that part of us. And thank you, Alison, for your introduction. So first I need to figure out how to work this thing. There we go. Yoo-hoo. So I think everybody wants to know, where is this plan up to? So we have got a new and enthusiastic steering group, which is exciting because, I don't know if you know, we got restructured, and actually every single person we had in our steering group got a new job, retired, left. So anyway, we've got a new one, and that's meant that we've had some policy input, so it's moving along. So we've kind of done our draft developing, and the next part that we're on to is getting agreement for leadership. So that's kind of important because from the ministry's point of view, without agreement for people who are going to lead all the actions in the plan, that's not going to go forward. And then lift off, beginning, hooray. I had wanted to put a nice rocket design in there, but my computer wouldn't comply. So the plan's got a bunch of priority groups, and there are lots of priority groups in here. So particularly young people are a really big priority group, carry most of the burdens of STIs, of unwanted pregnancy, of sexual violence, and really appalling for LGBTIQ young people, stigma and discrimination, and the outcomes from that. And as I think Hannah brought up, you know, Māori and Pacific people are particularly experiencing those issues. Women living in high deprivation, young people at risk of sexual violence, young people living in care in particular, and attending alternative education or teen parenting units, really across the board very difficult outcomes. Gay and bisexual men, sexuality and gender diverse communities, sex workers, migrants, refugees, people of diverse cultures, people living with HIV, there's quite a few. People living in rural or remote communities, particularly people with drug and alcohol addictions and people with disabilities. So in all the plans we've put forward that there needs to be equity actions that particularly address the needs of those groups. So the structure of the plan, okay. So part of it, the first part on the left deals more with determinants of health. So I think Hannah was really amazing this morning when she talked about the silence and the stigma and the secrecy around everything sex. I mean, everything sex seems to have stigma and discrimination. And I'm just wondering, can anybody listen to Bang? Yeah. Fabulous, wasn't it? So this is a Radio New Zealand program, there's 6 of them, and it goes through a whole lot of different aspects of sex and sexuality, and it's very charming, and you can get it on podcast. But in general, everything is silent. So one of the big difficulties has been forever is getting healthy sexuality education because of that underlying stigma. The other part of that is this whole kind of Victorian attitude that my forebears brought with them, where on the one hand we have let's not talk about sex, and on the other hand we've got everything porn that you could think of. It's not a particularly healthy model. And so that's led to a bunch of things like sexual violence and rape culture, and all the stigma and discrimination that we were talking about before. Within the healthcare setting, what we're really looking at there is all those different issues, and the key strategies will be around really strong workforce development, and workforce development needs to include that it's culturally competent, culturally friendly, youth-friendly, medically competent. All of those things are really critical to really good care, and that, when we did our consultation, that came up over and over and over. And I really acknowledge what Hannah was saying this morning about the experience of the young man that she was talking about. These are unacceptable experiences for healthcare. Everybody needs to be treated with dignity and respect. So that's certainly going to be a big part of the work that we're doing. And part of that will be developing a bunch of guidelines and supporting the guidelines, and part of that will be looking at cost. So I've got a few reproductive health slides that I'll run through quickly because I know you guys are more interested in sexual health. But I thought this was really interesting because it's about birth rates. And if you look at birth rates by both ethnicity and deprivation, you can see really strong effects of both cultural preference and equity or inequity of access. So to a certain extent, cultural preference is not the business of the Ministry of Health. That's a legitimate choice. but equity of access completely is. So there's a really strong, you can see the line there about basically the less money you've got, the more children you're having. Now that could be potentially because people who have less money want more children, but the qualitative research would tell us that that's more to do with barriers. So those barriers will be cost, the barriers will be about being time poor, the barriers will be about feeling uncomfortable with the care that you're getting. So those are all some of the things that we want to address. I'll just go. This I thought was really interesting. This was done by the lovely Bridget Murphy from the Ministry, who will be presenting later. But I thought it was quite nice because it shows that having babies is actually not all the time about absolute joy or absolute disaster. You know, there's a lot of ambivalence, and we like to pretend that it's one or the other. Actually, it really isn't. But the main point of that slide is to see that it's very age dependent. So you can see that the younger you are, the more likely you are to have unplanned, and that's often verging on unwanted pregnancies, than older women. And this is a quick one basically to show that if you're having a termination of pregnancy, it's mostly not because your contraceptive failed, it's because you weren't using any contraception. So we were really fortunate in getting a budget bid through that's going to allow us to do some work in that area. So the important things that we'll be doing will be around looking at providing low-cost access, low-cost access for women with low incomes. In particular, looking at the really reliable sorts of contraception that are really expensive. So it's probably about 150, anywhere from 80 to 150 to get an insertion of a Jadel or an IUD, and easily 150 to get those removed. And they're often not done well. So the other parts of that is developing new guidelines and training. So a big part of that training, again, as I was saying before, is about developing really culturally competent and youth-friendly care. And so part of what we want to do is undertake focus groups from all the target groups of women to find out what their actual experiences are. So what are the enablers and the barriers? What do they actually really need from their care? Because we've got quite a lot of stuff on young people, not much on middle-aged women, not much on women 25 plus. I'm not going to talk in great detail about STIs because Jill's going to do that. But I just thought that for those of you who have been working on the combination approach to HIV, you'll be glad to hear that the Ministry is now officially supporting that. So this is a new announcement that we're making now. So, yes. But I think the real clapping needs to go to the AIDS Foundation, who I was just thinking need to run a session on policy advocacy. They're really good at it. So I think it was a lot of their advocacy that got the antiretroviral treatment being able to be prescribed immediately on diagnosis, which wasn't the case before. They've certainly got PrEP on the map, and I know Edward's sitting down here and he's done a lot about getting PrEP on the map too, and done a lot about trying to get that funded through Pharmac. So that's really impressive pieces of work. And so there's a bunch of things that will go into the plan around, again, workforce development, particularly around PrEP and STI treatment. One of the big ones we really want to get is proactive asking about sex and sexuality and sexual behaviour, because it's really hard to give good care if you've got no idea what someone's sex lives or sexual orientation is. This is where it turned up, right. Okay. It's in the wrong place. So the other part is more, as I was saying, about social determinants. So part of things is it's not really a determinant, sexuality education, but it's a really important piece of work to have done. I'm sorry, I'll try and stop doing that. And safety from stigma and discrimination and sexual violence and sexual well-being. So mostly we'll be looking at cross-sector and cross-government collaboration and safety at school. So comprehensive sexuality education, what was fascinating to me about when I started researching this is that what you get from comprehensive sexuality education in school is really similar to the outcomes you get from really good parenting and having those conversations at home. So we thought that there's actually a three-pronged approach to this. It's about keeping going at school. It's also about really looking at how you support parents, which is hard. They're hard to target. How do you get parents? All your brilliant ideas are helpful. And the other part is on social media, because that's where lots of young people said, we like the anonymity, we don't want to see text, we want to see video. Just tell us what we need to know, ideally by another young person and ideally by a celebrity. So those are some of the things that we're going to do. It's a bit tricky, that there's not that much curriculum time, which is a real difficulty. There are 7 different health subjects that get taught in health ed. One of them is sexuality education. It's only taught up to year 10, so it's very challenging to actually get the time that you need to do something as complex as sexuality education. So what we're trying to do is to work closely with the education sector. We've been working with ERO, and some of you in this room will have been part of the consultations that we did with ERO. They've just done a survey with 50 schools, and they've looked particularly at LGBTIQ issues, they've looked at cultural issues, they've looked at sexual violence, and they've looked at just basic knowledge about sex and sexuality. So that report should be out later in the year. So we're hoping to sort of piggyback a bit on the back of that to engage more with Ministry of Education, School Principals Association, Schools Trustees Association. 1. Oh, I haven't seen any of your things. Sorry. Okay. The other part that's... Oh, okay. Oh, okay. So the other part that's important is looking at sexual violence. So I think that I'll just tell you that it's common. The other thing to know about that, why is it common? Because, you're probably going to get away with it because there's a culture that supports that, and I think Nikki and Claire are going to talk a bit to that later this morning. So there's a few issues down there about pornography. The other issue for me, which I find really unacceptable, completely unacceptable, is these slides are looking at LGBT sexual health, mental health that's in school environments. This is from Youth 2012, and it's just awful that these are what happens to young people at school. And I think the most important part is realising this is not about sexuality, this is about a hostile environment. So, have we look at that? So after this session, we've got a session at 2:30, and for those of you who are wondering what the Sexual and Reproductive Health Rights Bill is, I'd love to say we've got a secret bill, but we haven't. The bill is to do with, it's actually just our plan. So we're going to just workshop the plan a bit more, get some more input from you. We'll put it into the different areas of interest that people want to work in, and we'll work with you on that plan to get your input this afternoon. So I think that might be me. So so that's what we'll do in the workshop is, what do you like? What links do you think you need to make? What do you want to amend? What do you want to add? And what do you want to keep informed about? So, thank you very much.